Okay. Good morning. How are you doing today? I'm Catherine, and I'm a student nurse at VSU. I'm going to be performing your wound care today, but first I'm going to get you to verify your name and date of birth for me. All right, and let me check your armband. All right, that matches the record, the physician's order. So, what I'm going to do today is we're going to change your wound care or your dressing, and this is for the purpose of assessing your wound, making sure it's healing properly, and also getting all that drainage out of there so it can continue to heal properly, okay? So, I'm going to put on my clean gloves, and I perform hand hygiene. Also, I want to make sure that pain medicine that I gave you about 30 minutes ago is kicking in. So, do you feel comfortable? All right. Put on the top of this bag. Okay. And I'm just going to set this bag next to your leg. I will also want to make sure that you don't touch the wound or touch any of my equipment, just to make sure that the wound doesn't become contaminated. I'm going to pour my solution in 2 of the containers. One is for my dressing, applying my dressing, and one is for cleaning, okay? So now I'm going to expose the wound. I've provided privacy, and I'm going to remove the dressing. And I want to make sure to pull towards the growth of the hair so that it's not uncomfortable, okay? Okay. There's some purulent and sanguineous fluid on the dressing. Also going to pull this out. Okay. All right. So with that, I'm going to remove my gloves, perform hand hygiene, and apply new clean gloves in order to clean the wound properly. Everything's still okay? So, and it is okay if I were to grab these gauze out of the sterile field as long as I'm only touching the gauze. So that's what I'm going to do. This is for my cleaning solution. I'm going to wet it, bring it out, and clean the base of the wound. And wet it, bring it out, and clean the insides of the wound around the edges. In this case, I'm going to use 2 separate gauze just to be sure that I'm not spreading any of the drainage to the other side. Okay. I'm going to use these Q-tips, and they are sterile, but these are going to be for cleaning my tunnels and also measuring my wound. So I'm going to measure my wound with this, the length, the width, and since I didn't touch the outside of the wound, I'm going to measure the depth of it. Okay? And And I would have marked this and measure it with a ruler. Oh, that's what this is for, huh? Okay. So let's try that again. It's about 6 centimeters in length. And it's about 5 in width. And 1 in depth. Now I'm going to use a separate Q-tip to measure the tunnels and clean them at the same time. Okay, that's 3 centimeters. And I don't have any extra Q-tips, but in this case I would measure the other tunnel, clean it at the same time, and document that. Okay? So, now I'm going to clean the outside of the wound. I would only clean half of it, put it away. Half and throw it away. And then I would dry the wound. Okay. Now I'm going to remove my gloves, perform hand hygiene, and in this case I will start performing the sterile gloving and applying the new dressing. These are actually on the wrong side, so I'm just going to start over here. Okay. And I would keep my hands above my waist. Come over here to my sterile field and begin applying my wound. Okay. So I'm going to use my other solution over here that hasn't been used. I'm going to fluff the gauze. And you notice my blue paper got wet, but that's okay because it's waterproof. I'm going to grab one of these sterile Q-tips. Be sure to fluff this. It's hard to fluff when it's wet. Okay. Okay. And I'm going to start packing my tunnels. I want to make sure to be gentle with the patient. Sorry. I'm going to have to get another piece of gauze and wet it. And I would throw this Q-tip away. And grab this other Q-tip that's sterile and finish my dressing. Okay, I want to be sure that none of the gauze is sticking out of the wound. So, throw that away. And now I'll begin putting on my my dry gauze on top of the wound. Okay. If I needed to, I could use this. So put that on top. And now at this point, the wound is sterile, so I can remove my sterile gloves and begin taping the wound. I want to tape the length of the Okay. I would also take a piece of tape, write my initial it, the time and date the wound was changed, and finish making sure the patient is comfortable. So, Mr. Jones, are you comfortable? Did everything work out like you thought it would? Do you feel any kind of pain right now? Can you rate your pain for me on a scale of 0 to 10? Okay, 1 is good. 1 is good. All right, well, at this point, I'm going to clean up all my equipment. I'm going to cover up your wound for you. And as long as you're comfortable, I'll be back to check on you in a little bit, okay? I'm also going to wash my hands.